My purpose today is to encourage you to support breastfeeding by educating you on the benefits. As a mother of 5 children, I can tell you firsthand that the choice to breastfeed has benefited me and my children in more ways than one. Modern science has recognized breastfeeding as a means to save lives, reduce illness, and protect the environment. Policymakers are increasingly recognizing that breastfeeding promotion efforts can reduce healthcare costs and enhance maternal and infant well-being. Breastfeeding promotion and support has been recognized as a healthcare priority by the World Health Organizations, to include the United States Department of Health and Human Services, the American Academy of Pediatrics, the American Dietetic Association, the American Public Health Association, the American College of Obstetricians and Gynecologists, the American Academy of Family Physicians, and the Healthcare of Mothers and Infants, family physicians, and numerous other institutions and organizations concerned with preventative medicine and the healthcare of mothers and infants. We should give our children an optimal chance and a good, healthy start by promoting breastfeeding. One reason why it is beneficial to breastfeed is because human milk is uniquely suited for human infants. A woman's body was designed to feed her young and is equipped to supply the infant with all that it needs. Most babies find it easier to digest breast milk than they do formula. As reported by the U.S. Department of Health and Human Services, breast milk is the most complete form of nutrition for infants. A mother's milk has just the right amount of fat, sugar, water, and protein that is needed for a baby's growth and development. Additionally, the fatty acids in breast milk aid to optimal brain and visual development. As a result, breastfed babies grow exactly the way they should. Now that I've shown you how human milk is uniquely suited for human infants, let's move on to my second point, which is breastfed babies are healthier. On a radio interview with Surgeon General Richard H. Carmona, shown on womenshealth.gov, he states, "There are a lot of reasons why moms want to breastfeed, beginning with just bonding with their newborn. Clearly, the studies show that the closeness develops even much better through breastfeeding, but medically there are reasons. The studies have shown that babies who are breastfed have less diarrhea, have less ear infections, have less respiratory infections, and most importantly, today they're less likely to grow up with the problem of obesity, which is plaguing our youngsters today. Additionally, breast milk contains antibodies to fight illnesses. Breast milk reduces and lessens severity of bacterial infections such as meningitis, bacterium, and urinary tract infections, and presents some protection against allergies. Breastfeeding reduces healthcare costs with less infant illnesses and less hospital admissions. According to an article, Role of Nutritional Programming in Determining Adult Morbidity, research and studies gathered by A. Lucas show those who are breastfed have less adult illnesses such as heart disease, stroke, hypertension, and autoimmune diseases. Health costs to federal and state governments and private health care systems because of health costs to federal and state governments and private health care systems because of not breastfeeding appear to run into billions of dollars. Estimates to date have been conservative, as they usually include neither parent lost work time nor other costs that occur with children when children are ill. My third point is to show how breastfeeding is also beneficial to moms. Nursing uses up extra calories, making it easy to lose pounds of pregnancy. It also helps mom's uterus to get back to its original size and lessen any bleeding a woman may have after giving birth. Breastfeeding lowers the risk of breast and ovarian cancers and possibly the risk of hip fractures and osteoporosis after menopause. Breastfeeding makes your life easier. It saves time and money. You do not have to purchase, measure, and mix formula. One of the things I came to appreciate the most was that there are no bottles to warm in the middle of the night. Lastly, let's look at how breastfeeding is beneficial to society. Breastfeeding saves on health care costs. Total medical costs for the nation are lower for fully breastfed infants than never breastfed infants, since breastfed infants typically need fewer sick care visits, prescriptions, and hospitalizations. Also, breastfeeding contributes to a more productive workforce. Breastfeeding mothers miss less work as their infants are sick less often. Employer medical costs also are lower and employee productivity is higher. Additionally, breastfeeding is better for our environment because there is less trash and plastic waste compared to that produced by formula, cans, and bottle supplies. To sum up, you now know that human milk is uniquely suited for human infants, providing all the nutritional value that the baby needs. Breastfed babies are healthier. Breastfeeding is also beneficial to moms and society. Given that breastfeeding is disease preventative in its purest form, it seems necessary and proper for healthcare providers, administrators, and policymakers under pressure to reduce medical costs to promote and support breastfeeding. If breastfeeding is to be accepted as the lifestyle choice for more women, our culture must support it. Surgeon General Richard H. Carmona states one of his responsibilities as the physician of the nation is to make sure that moms as well as dads, families, businesses, and generally our whole society understands the importance of breastfeeding. The Surgeon General also states we should make as much accommodation as possible because breastfeeding helps us to ensure that our children will be raised optimally healthy. Every mother has the right to decide how her infant will be fed. When asked, most breastfeeding women say they chose to breastfeed because of health benefits for their babies. Yet, despite overwhelming evidence that breastfeeding babies are healthier, only 49% of new mothers are exclusively breastfeeding at 1 month after their baby's birth. If the healthcare dollar savings and health benefits of breastfeeding are to be realized, further education and support of our mothers, further education and support of our mothers, families, communities, and healthcare professionals are imperative. Breastfeeding is not just a lifestyle choice, it is a health issue. Every baby has the right to the best breast.
That's very proud.